We are joined by Dr. Megan Evans. She's an OBGYN at Tufts Medical Center. Dr. Evans, thank you for taking the time to talk to us today.
Thank you for having me.
Now, we're going to talk about the claims made by President Trump regarding Tylenol and autism. So on Monday, President Trump said using Tylenol could lead to autism, which is a scientifically unproven claim. So can you talk to our expecting mothers who are watching this? They might be in a panic. At the very least, now they have questions. Talk to them about the safety of Tylenol. What are the facts about Tylenol use as an expecting mother?
Yeah, I mean, I think for our patients, it's really confusing to get this information while they're pregnant directly from the White House. What we know about acetaminophen or Tylenol is that it's a well-studied medication. It's been studied for over 20 years and proven to be safe use in pregnancy. Additionally, science does not support the claims that acetaminophen use during pregnancy leads to autism. And in fact, there's been some really recent robust research studies that have reinforced that Tylenol use during pregnancy is not associated with an increased risk of autism.
Okay, and there's another point that I was like, okay, I've got to ask the doctor about this. At one point, President Trump told pregnant women to quote, tough it out when it comes to pain and
Yes.
fevers, which can be equally, if not more, as dangerous to mom and child. Can you talk to our viewers about why it's not a good idea to tough it out?
Absolutely. Yeah, I mean, I think what's really challenging for our pregnant patients is that there isn't a lot of safe medication to use in pregnancy.
Mhm.
And Tylenol is one of those medications we know is an important treatment for fevers, for pain, for headaches in pregnancy. And we know that an untreated fever in pregnancy can actually cause quite a bit of harm. We know that sometimes pregnancy can be painful. There can be ailments in pregnancy that can cause pain, and we certainly don't want our patients to go without treatment and without pain medication. Sometimes patients can have headaches, and some of these things, most of these situations can be harmless, especially if treated appropriately. But there are times when an untreated fever or untreated pain can actually cause harm. And we know that when medications like Tylenol are used in appropriate doses, they are safe and important to take in pregnancy to treat those conditions.
And so really the big takeaway for our viewers is it is safe to use Tylenol as a pregnant woman, as an expecting mother in consultation with a doctor.
Exactly. And so, I think, again, it's one of these situations where our patients are bombarded with information and
Mhm.
sometimes inaccurate information. It's really hard for them to navigate the decades of research that have come out about acetaminophen and the safety of it. So I really encourage patients to have a conversation with their doctor, talk about safe medications to use in pregnancy, because we want our patients to get the best care that they can. And especially when it comes to medication use, we're always talking to patients about what's safe. And what I don't want to happen is for patients to go untreated or potentially to turn to medications that we know are not safe in pregnancy, things like ibuprofen, Advil. So that's where you really need to have a conversation with either your OBGYN or your midwife.
And what about mothers who have already had their baby, right? But they're like, well, if is it safe for me to give Tylenol to my baby now too? Because I believe the president also said something about parents not giving Tylenol to their babies either. So some parents might have questions about that as well.
Absolutely. And that is certainly a conversation they should have with their pediatrician. Again, there are times when it's really important to treat high fevers, and especially in babies and infants and children. And so we know, again, the data does not support that Tylenol is a direct causal impact on causing autism. And so that's really a conversation that should happen with a pediatrician and talking about what safe doses of the medication should be used.
Now, is there anything that's important for viewers, expecting mothers, even the fathers who play a big supportive role, families watching? Is there anything that's important for them to know that I didn't ask you specifically?
I think in today's day and age with how rapid information is coming, I really want patients to take a moment to not take everything for face value, especially when there's a lot of misinformation about medication use. Especially when it comes to autism. We know that autism is likely multifactorial. There is not one thing that leads directly to autism. And what we really have concerns about is our patients going untreated for things like fevers, pain, headaches in pregnancy. And we want patients to have that conversation with their physicians or their medical providers to know what's safe to take in pregnancy.
Well, Dr. Megan Evans, thank you, OBGYN at Tufts Medical Center.